After doing a ton of research, I realized that the Solea was the best laser out there. Finally found a laser that I felt was a real medical grade laser, and that we're implementing into dentistry. So after I purchased it and started using it in my practice is when I really had the big aha moment. Within the first 2 weeks of getting the laser, I had to do an unveiling for, doing a second stage unveiling for an implant. And I didn't use any anesthetic. And I had to go ahead and remove probably about 7 millimeters of tissue depth. It was pretty deep buried underneath there. And I went ahead and I exposed the head of the implant without any anesthesia. And I was able to festoon the tissue gorgeously for an emergence profile. And it was painless. The patient didn't feel anything. And that was my first really big, exciting moment. I had spoken to a number of doctors and I asked them, the first question I asked was like, does the laser give back, a good ROI in terms of increasing production? And everybody's like, absolutely yes. And then until I started implementing it, I'm doing a lot more procedures. I've expanded the types of procedures that I'm doing. So it's paid for itself multiples over. I'm doing a lot of crown lengthenings, and I'm also saving a lot of teeth that most people would not save. So I'm doing a lot of procedures that even I couldn't perform or I couldn't do without the laser. It's just expanded my armamentarium and my ability to, save teeth that were pretty much rendered either guarded or completely hopeless prognosis. Now they're totally, we're coming up with ways of saving these teeth, not pulling them and going directly into implants. The Solea lasers allowed me to do a lot more procedures in one sitting. We do market and cater to a lot of high anxiety patients, and a lot of them will come in and they'll be like, oh, I want to only get like this one filling done. Then after just doing one filling, they look at me and they're always like, is that it? And I'm like, yeah. They're like, then let's just do the rest of them right now and get it out of the way. So I end up going from one filling to getting like 5 or 6 out of the way all at once. So it's made me a lot more efficient. It's a much better experience for the patients. So it can change your practice just by making you a better clinician overall. If you're detail oriented, if you want to have a better outcome, you want the patient to have a better experience, it helps the practice comprehensively in all those aspects. I truly believe that the Solea laser and the CO2 and this technology is going to be the way dentistry is going to be done. It's going to be part of every dentist's armamentarium, just like the high speed is. And once you start working with it, you're not going to want to do dentistry without it because it makes so many aspects that make dentistry frustrating and annoying and simplifies it and gets rid of those problems. And then two, it'll just expand so much more of what you can do.